Hello, dear colleagues. My name is Irena Prat. I work at the World Health Organization, where I'm responsible for the in vitro diagnostics assessment team within the pre-qualification unit. It is a privilege for me to have a chance to share with you some introductory remarks to this webinar. The pandemic drew an unprecedented attention to diagnostics as a key health commodity supporting clinical decision-making. Diagnostics have proven their high relevance in the healthcare value chain and have been critical in managing the COVID-19 pandemic. This has underlined more than ever before their importance in saving lives. Aiming at advancing universal health coverage and health equity, WHO passed a resolution on strengthening diagnostics capacity. This resolution, adopted during the 76th World Health Assembly on 23 May 2023, aims to address the challenges related to access, affordability, and quality of diagnostics, including IVDs. This resolution offers an opportunity to make a big step forward in increasing access to much-needed health technologies. WHO looks forward to further strengthening the collaboration with all stakeholders invested in strengthening diagnostics capacity to accomplish the many ambitious goals set forth in this resolution. In this context, I wish you all a very successful webinar.
Thank you, Chris, and dear participants. Thank you for inviting me to this webinar. And just to begin with an update, since February, I've since moved on from being the unit head for pre-qualification, but I'm also now the director for health products policy and standards. So still in the same area, but now responsible for making policies and standards that indeed govern health products, including diagnostics. To say that the health COVID pandemic has been a wake-up call for public health. The pandemic has put on spotlight diagnostics as never before. Patients arrived at the healthcare services with fever, coughing, unable to know if it was pneumonia, tuberculosis, or COVID. Only a correct diagnosis can let the medical doctor proceed with appropriate clinical treatment. In fact, diagnostics are used every day in all healthcare services and not just during pandemics. Diagnostic services play a vital role in preventing, diagnosing, managing, monitoring, and treating a wide range of diseases, injuries, and disabilities, including communicable and non-communicable, neglected, and rare diseases. They are crucial for achieving universal health coverage, including primary health care, and implementing international health regulations, providing access to high quality and equitable access of services across the healthcare continuum. Diagnostics are the most important tools that empower the health workforce in the identification of diseases or health conditions that allow the initiation of treatment and in order to avoid further complications and costly treatments for patients. Excuse me. WHO member states recognize the critical role of diagnostics by adopting a resolution 76.5 on strengthening diagnostic capacity in May 2023. The resolution is a comprehensive list of actions which we should all take and implement. It recognizes past resolutions on health products, for example, on affordability and pricing, on pre-market and post-market regulations of diagnostics as a type of medical device, on technology assessment, and focuses on the diagnostics which have been left behind and brings them to the forefront. The resolution considers the full spectrum of diagnostics, including medical devices used for diagnosing, screening, monitoring, prediction, staging, or surveillance of diseases or health conditions. These include in vitro laboratory and non-laboratory tests, ranging from simple pregnancy tests to complex automated clinical chemistry, pathology, multiple and other non-in vitro diagnostics, including from simple pulse oximeters and blood pressure measurement devices, electrocardiograms, endoscopes, to all diagnostic imaging technologies like ultrasound, all the way to magnetic resonance and PET scanners. The resolution covers research and development, manufacturing, including local production and technology transfer, regulation, selection, procurement, awareness, advocacy, and addressing barriers in general. It gives the opportunity to align the work and in particular the support, support primary health care for universal health coverage and emergencies. To address critical gaps and improving diagnostic capacity, the resolution builds on WHO work at the headquarters, regions, and the country levels. However, the work needs to be amplified and accelerated. Like the WHO Essential Medicines Model List, that has been a WHO flagship for almost 50 years. WHO is also continuously working to update the list of essential in vitro diagnostics and priority medical devices used for diagnosis in the last 6 years. The fourth essential diagnostic list includes 156 categories of in vitro diagnostics that can be used in primary healthcare level, including by patients and for laboratories and critical public reference laboratories and in health facilities that have no laboratories. The essential drug list includes recommendations, the evidence of the type of tests and multiple assays formats that can be used. WHO has launched a call and is now preparing the 5th edition of the WHO model list of essential in vitro diagnostics. The priority medical devices list includes 2,301 products, out of which 790 are used for diagnostics. These include all types of diagnostics, reagents or laboratory equipment, imaging equipment, ophthalmoscopes, patient monitors, etc., etc., and all those used for diagnosis, measurement, monitoring. It complements the essential diagnostic list by defining the technical characteristics of the specific type of technology. Nevertheless, access to these devices can be limited if a number of conditions are not met, such as the production of quality, affordable, and safe diagnostics, the effective regulatory approval systems are in place in the countries, and that ministries are committed to develop, update, and implement national lists, including supporting the efficient supply of products, as well as training and appropriate use of the devices and proper decommissioning. It is a mandate from the resolution to avoid siloed approach by disease and to include development of national diagnostic strategies and integrated networks, which is the major challenge globally and particularly in low and medium income country settings. Diagnostic technologies developed for COVID in an incredibly first time is a road to incentives to continue technology innovations to diagnose other diseases in case of future pandemics, but also to have diagnostic platforms that can help address unmet needs, especially in lower resource settings where neglected tropical diseases require specialized diagnostics to search for other diagnosis or for other diagnosis for non-communicable diseases can mostly is used most effectively. Recently, to support the diagnosis of imaging technologies, computer-aided diagnostic is being developed, and telemedicine that was initiated decades ago is taking a major deep leap to support diagnose where specialists are not available. The ASEAN region, WHO has been working closely with the area, the Economic Research Institute for ASEAN and East Asia since 2001 on increasing access to diagnostics. As part of this work, WHO in collaboration with area undertook a gap analysis of mapping the availability of in vitro diagnostics in national healthcare systems in 4 ASEAN countries, namely Cambodia, Philippines, Thailand, and Indonesia, as well as in Timor-Leste in relation to the WHO list of essential in vitro diagnostics to form next steps in efforts to improve the WHO model list for essential diagnostics and access to such diagnostics in Asian region. Reports for each country were prepared and shared with countries. Then the findings were discussed in workshops held in 5 countries and draft roadmaps developed the national EDO were prepared. The collaboration with area will continue as we plan to expand the work in other Asian countries and help countries from the first phase of the project to develop and implement their national essential diagnostic list. These examples of our work show how WHO is working to implement the new resolution on diagnosis. However, WHO cannot do it alone. In order to implement the resolution, we call upon partners in the room and beyond to work with us at WHO to meet the diagnostic needs. And in particular, WHO needs your support to help us address the diagnostic gaps to address the non-communicable disease burden, elimination and eradication agenda, health emergencies and pandemic preparedness and response, and cross-cutting surveillance like including antimicrobial resistance. WHO would like to thank you for your attention and welcomes ASEAN support towards increased access to all types of diagnostic technologies to support primary health care, universal health coverage, and address pandemics and emergencies in an effective way. I thank you very much.
Thank you, Deuce, for those great words. And I can only echo what you were saying about the need for partnerships to drive this forward. That's one reason why the Council's been doing this work with our partners, and any support we can provide to ensure that diagnostics gets greater awareness, and indeed, particularly in middle income or lower income countries as well, you can count on us to provide that support going forward. If you don't mind, Deuce, before I let you go, but you're more than welcome to stay throughout if you want, can I just ask you one question? And it really is about what I was just mentioning. How do you see the resolution as helping to improve access to diagnostics in underserved populations, especially in the low middle income countries?
Yeah, first of all, just from the point that you've talked about, I think the resolution has mobilized global support and brought, as I mentioned in my remarks, this has been a neglected area. And even, I must admit, including WHO, not well resourced, not well mainstreamed. The resolution has brought it to the limelight and mobilized member states. It was very widely promoted. So we hoped, first of all, this resolution, and outlines clear action points for member states, but also for WHO Secretariat, and will help us garner the partnerships, including like the one we are demonstrating here today, to support countries to improve diagnosis and diagnostics in especially low and medium income countries.
Thank you, Juice. Thank you again. You are welcome to remain with us and maybe even join the panel later if you want to. But thanks very much for those kind words. We also have the honor of welcoming now Ms. Ho Yuan Lu. She's Vice President of Outreach and Talent Development, Diagnostics Development Hub, hosted by A-Star here in Singapore. She's delivering the speech on behalf of Dr. Jaime Montoya, co-lead of the ASEAN Diagnostics Initiative, Executive Director, Philippine Council for Health Research and Development. Yuan Lu, please.
Thank you, Chris. It is my privilege to deliver these following remarks on behalf of Prof. Montoya, who is the co-lead of the ASEAN Diagnostic Initiative platform. So to the Secretary General of the Association of Southeast Asian Nations, His Excellency Dr. Carl Kim Horn, the World Health Organization Regional Director of Southeast Asia, Dr. Poonam Singh, and to our esteemed panelists and webinar guests, a very good afternoon to all of you. Today, we gather to deep dive into discussions on diagnostics, which is the core of effective healthcare delivery, as decisions guiding patient care depend heavily on these accurate diagnoses. To put this in numbers, up to 70% of clinical decisions hinge on the results delivered by diagnostic tools. These decisions made the difference between life-saving treatments and devastating delays. Yet, we see from the numbers, diagnostics receive less than 1% of healthcare expenditure, and about 47% of the world's population has limited access to these services. The COVID pandemic served as a wake-up call. The ability to identify and isolate cases swiftly proved instrumental in controlling the spread of viruses, highlighting the impact of a sturdy diagnostic system that's needed in the country. As we navigate the post-pandemic landscape, we must assess the progress that we have made in diagnostics adoption. We must ensure that the invaluable lessons learned from the pandemic and the best practices adopted during this crisis is not lost, but becomes the foundation for a future where everyone can access accurate and timely diagnosis. This gathering today builds upon past conversations regarding diagnostic access and adoption within ASEAN. However, today, we also celebrate a recent landmark achievement, which is the 76th World Health Assembly's groundbreaking resolution on strengthening diagnostic capacity. This resolution champions a universal approach towards diagnostics, emphasizing the need for comprehensive diagnostic strategies, equitable access to testing, and the role of diagnostic data in informing healthcare decisions. This webinar tackles these issues, focusing on the experiences and priorities of the ASEAN member states. We will explore the impact of the WHA resolution on regional priorities and implementation of diagnostic strategies nationally. Equitable access across all communities, including remote and underserved areas within member states, must be an important focus. We will analyze how individual member states align their national healthcare policies and resource allocations with the resolution's goals and examine their challenges, and also explore strategies to bridge these gaps. Finally, we will explore how ASEAN member states can collaborate regionally to address common challenges. This includes capacity building to develop a skilled workforce, technology transfer to ensure access to state-of-the-art diagnostic tools, and regulatory harmonization to create seamless diagnostic equipment and testing systems across borders. All these efforts are important for building a well-organized regional diagnostic system. Our recent regional discussions through the ASEAN Diagnostic Initiative unearthed valuable insights. Today, I want to highlight 4 key areas where working together can dramatically improve access to diagnostics and build a more engaging healthcare system within our region. Firstly, let us streamline our regulatory frameworks within the region. Think about an ASEAN that could expedite the approval process for diagnostics, bringing life-saving tests to people faster. It will be based on strong regulatory science with standardized development and evaluation procedures that will ensure quality and safety of these products. This will help in building trust within our communities. And additionally, a pre-market validation system with a centralized data sharing platform can revolutionize how diagnostics are assessed across the region. Secondly, focus on product development and quality assurance of diagnostics, perhaps performed through a network of strategically placed quality laboratories throughout ASEAN. They can act as a moving locomotive for progress. These labs will share resources like qualified biological samples and performance databases, thus accelerating the development of diagnostics tailored precisely to the region's needs. Thirdly, strengthening diagnostic capacity building in ASEAN. The same network of labs can play an important part here by facilitating the sharing of qualified samples and performance data. These labs will empower the development of ASEAN-specific diagnostics. These efforts can lead to establishing regional manufacturing of reagents and materials, which can further bolster diagnostic capacity within the region. Lastly, working collectively with public health officials and policymakers is paramount. A dedicated regional committee on diagnostics would facilitate ongoing dialogue between the scientific communities and policymakers. This will bridge gaps, encouraging partnership and advocating for increased investment in diagnostics across ASEAN. A multi-sectorial approach involving all relevant stakeholders, from researchers to government officials, will ensure the development of diagnostic policies that serves everyone. Our recent discussions in ASEAN revealed exciting possibilities. By promoting open dialogue, sharing best practices, and embracing solutions, we can work together to strengthen diagnostics capacity throughout our region. This, in turn, will lead to vastly improved healthcare for all, ensuring that no one is left behind in the pursuit of better health. Let's utilize the potential of diagnostics to unlock a healthier future for ASEAN, where access to accurate diagnosis is the norm and not the exception. Together, we can transform the Southeast Asia region, where timely and accurate diagnosis empowers healthcare professionals and patients, leading to a brighter and healthier future for all. Thank you, and we wish you a successful webinar.
Sorry. Thank
Chris,
you,
you are muted.
Yes. Thank you, Wan Lu, for those words. I was very interested in your comments about taking a more of a harmonized approach across Southeast Asia. ASEAN, in my view, has not been very good at that in a number of different areas. Let's hope in this one they can be stronger and more committed to it. If you don't mind, I know you need to leave, Wan Lu. If you could ask you all, please, just to smile nicely and look at your cameras. We'll take a quick group photograph before we move into the panel discussion. On 3, 1, 2, 3. Fantastic. Jen says everything's good. Brilliant. Thank you. Right, we're going to move in now to our panel discussion. I have a very good, very senior and well-versed panel here. I'm good to see that Deuce is remaining with us. My panel today are Gillian Sachs, who's Director of Global Health Policy at Roche Diagnostics. Thanks, Gillian, for joining us. Kenny Lam, who's the Executive Vice President and Head of Diagnostics for Asia Pacific for Siemens Healthineers. Andrew Hickey, he's Associate Director for Laboratory Sciences at the Centers for Disease Control and Prevention. I think he's joining us from Vietnam this afternoon. Mohammed Harif bin Mohammed, CEO of Premier Integrated Labs from Malaysia. Harif, thank you for joining us. And last but not least, Dr. Samish Kumar, who's Senior Director at JPIGO. I think I pronounced that right. Thank you all for joining us. Harif, I know you need to run away fairly soon, but if you'd excuse me, I will fire the first question at Gillian, if she doesn't mind. Gillian, we've heard about the WHA resolution. Since its adoption on strengthening diagnostic capacity last year, what notable opportunities have emerged for diagnostics adoption within the Southeast Asia region? And how do we meaning private stakeholders, public stakeholders, NGOs, academics, ride on that momentum to promote more diagnostics adoption?
Thank you, Chris, and good morning, good afternoon, good evening to all the participants, and thank you again for including Roche in this esteemed panel discussion. So as we heard from the excellent opening remarks from the WHO, adoption of this resolution last year was an historic achievement for the diagnostics community. But we really do need a multi-sectoral approach in order to maximize the impact of the political commitment that was made by WHO's 194 member states, including those within ASEAN, necessitating bold leadership as well as shared accountability and transparency across the different stakeholders. Collectively, we really need to increase political will, recognizing the importance of diagnostics to address the acute care needs of today, prepare for future pandemics, and enable efficiencies across disease programs. So to do this, we should establish strong networks and communication materials to highlight best practices, share concrete examples of effective policies and implementation approaches, generate evidence on what works and what challenges need to be considered, clarify the needed resources, and help countries to create integrated, fit-for-purpose roadmaps to address the diagnostic needs of their populations. If member states in ASEAN enhance their diagnostics capabilities and incorporate diagnostics within their national UHC benefit schemes, this will contribute to achieving 3 of the 4 ASEAN health cluster goals, namely promoting a healthy lifestyle, responding to all hazards and emerging threats, and strengthening health systems and access to care. And finally, echoing the words that we heard earlier, we would really encourage ASEAN to develop its own regional diagnostic strategy, given the political impetus of the resolution, which would enable the region to show strong leadership.
Thanks, Gillian. Penny, I'll come to you next as the other private sector rep on this panel. What are the areas of development you foresee happening in diagnostic technologies, particularly for addressing healthcare gaps in the APAC region? Kenny, could you hear me?
Yes, sorry. Thank you for the question and thank you for the invitation from the EU-ASEAN Business Council. I believe that this is very important. Equitable access to safe, effective, and quality assurance diagnostic requires a comprehensive healthcare system approach by the global healthcare player like us, as well as by the governing national health system, still because of 50% of the world population do not have the accurate access to the diagnosis. We support the resolution, and actually we noticed that in Siemens Healthineers, we are aware the lack of qualified healthcare staff is a major roadblock on the way to access the diagnostic for all. And the use of high quality, innovative medical technologies supported by a digital solution can help the mitigation of the burden of the healthcare worker, allowed to deliver reliable diagnostic quickly. We all know that digital solution is important. AI is coming. I think this is also the core competence, not only Siemens Healthineers, but also the key medical player in the IVD field. And also the training of the healthcare professional, like the medical doctor, nurses, and also the laboratory professional is important. Biomedical engineer and community healthcare worker also should know how to effect use of the diagnostic test save the life. The COVID time actually provide very good exposure for the public society. What's the power of the IVD and diagnostic solution? So I believe that we as a medical healthcare provider, manufacturer, the technology of the IVD test, digital solution can pretty much help to implement the action item of this resolution, especially have the more access of care to all the member states. We are very much welcome the recommendation of the resolution of the WHO to take a horizontal health program approach for all the diagnostic across disease, and also avoid silo guidance, and also support membership states to create and optimize the integrated diagnostic network and services. We, Siemens Healthineers, as a manufacturer for both imaging and also laboratory point of care diagnostic kits, with the mission of pioneer breakthrough in healthcare for everyone everywhere. We enable medical staff in all healthcare systems, be in higher or lower resources setting, to make the right diagnostic support by high quality and reliable technology. And again, thank you for the invitation for this panel. Thank you, Chris.
Thanks, Kenny. Harry, if I come to you before you need to escape away. We've heard discussion already from your fellow panelists and from Wainu just now, and indeed from Deuce earlier, about the need for greater collaboration, working in partnerships, across regional approach, etc. How do you see collaboration between diagnostic service providers and healthcare institutions further facilitating the adoption of advanced diagnostic technologies? And perhaps a second question to you as well. How have you seen the landscape for diagnostics change in Malaysia in the last couple of years?
First, thank you for inviting me to be a panelist in this webinar. In Malaysia, we see there are a few key changes that have contributed to the progress in diagnostic adoption. Number one is the increased awareness and knowledge within the society, and the increase in visibility post-pandemic. So the improvement in diagnostic adoption here in Malaysia can be seen in three areas. Number one, we see there is an increased investment in healthcare infrastructure significantly from both the government and the private sector that have enhanced diagnostic capabilities in both areas. We also see now there is greater emphasis on training and education, even in the government policies, the focus on TVET, and also the involvement of private sector to improve awareness as well as technology adaptation in Malaysia. And the third area is the policy support. We also see now the government is more open in their policies that promote adoption of new technologies and improve healthcare standards. And one of the interesting thing that we see in the white paper that the government recently announced is the emphasis on what we call the PPP, public-private partnership, where the government now is encouraging the private sector to lead technical or technology adoption in healthcare. And this is where we see opportunities where the private sector, especially in the diagnostic areas, can play a role in increasing awareness and also accessibility for diagnostic in Malaysia. because within the private sector, especially the private lab services, it is easier or more faster for us to adopt technology. For example, the new technology like next generation sequencing, molecular diagnostics, and all the high-end testing into our services. And by providing this technology to be accessible within Malaysia, it will automatically reduce the cost of performing these tests, as well as improving the turnaround time for the services to be enjoyed by the public. I hope that answered the question.
It did answer my question. I do have a quick follow-up for you, because it touched on something that Kenny briefly mentioned as well. So the government's investing more and doing more to promote diagnostics. You did mention about doing more on training for the adaptation and adoption of diagnostics. Are there enough skilled people out there to work the labs and the machines, or do we need to invest more on the education side as well?
Yeah, we need both. We need more people to be trained, especially for the high-end technologies. We don't say that we have enough of them. More and more is better. Yes, we do need support from EU or even from the vendors to bring in technologies, as well as to create opportunity for what would I call technology transfer. Maybe by bringing in specialists to come and spend some time with our scientists and our technologies here, or bring in new technology from Europe or from the vendors into Malaysia.
Sorry, if I saw Kenny and Gillian both nodding there, so they want to jump in, please unmute yourselves and jump in. While you're thinking about jumping in, Andrew, I'll come to you. CDC, of course, very important institution. Can you share some examples of successful collaborations or initiatives between the centre and regional stakeholders aimed at promoting more diagnostic use?
Sorry, let me get off mute here. Sure. So CDC has a number of different ways that we engage in the region for strengthening laboratory diagnostic and adoption. And let me back up a little bit. We've heard it a few times that the systems in which the diagnostics are implemented are important. And I want to even say it, I think, a little bit more strongly. The systems in which the diagnostics are implemented are, in my view, as important as the diagnostic itself. So if you have a diagnostic going into a laboratory that's not appropriate for that diagnostic, or is not doesn't have the right systems in place to support that, it is not a functional way of moving this. So really, the laboratory cross-cutting systems, the quality management systems, the biosafety, biosecurity, the procurement mechanisms, shipping, all of those pieces that support the entire laboratory are as important as the diagnostic that's going in there itself. So to give examples of where CDC, I think, excels and works effectively throughout the region, I'm going to talk both about I'll talk about what we're not. We're not necessarily a procurement agency. We're not donating reagents and diagnostics to the region. What we are is a partner, and we try and work closely with regional partners, with public-private partnerships, with ministries of health in that technology transfer space, to work bilaterally through our country offices, regionally through our regional office, on workforce development issues, on technology questions, on how to plan and build these effective systems. So I think that that's where we're focused our efforts. Some examples of this, the Global Lab Leadership Program, I think, is a very good example globally of how we do this and what we have done in the region as well. There's several regional examples of GLP, both a regional ASEAN based in Thailand, and then several programs beyond that. And that is a program that was developed by CDC, WHO, FAO, WHA from the animal health side, and APHL, really to drive workforce development and being able to run laboratories effectively, both on a One Health sphere, so both at the human health, animal health, environmental health, really to try and build that laboratory staff picture. So it includes biosafety, biosecurity, procurement, how to consider operations, and how to plug in new diagnostics and through that. We've worked through pilot surveillance programs, enhanced gonococcal antimicrobial surveillance program for one, EGAS, that's looking at emerging gonorrheal antimicrobial resistance, and working with different pilot countries throughout the region to develop those capacities to look at what is happening in those areas. We have a lot of bilateral and regional engagements. We have worked through our PEPFAR program that is in combination with CDC and USAID and other US government partners that helps to develop HIV response so that we can move toward control of the program. So viral load testing mechanisms, trainings, access to reagents, access to those systems that help develop laboratories, which in the end help strengthen the full laboratory picture. So I think that kind of gives a little bit of a breath, but yeah.
So you really say we need to make sure the whole of the ecosystem is there to support the diagnostics.
Yes.
It's not just a question of putting the tests in or having the machines in, but everything around it,
Yeah.
the people, the infrastructure,
Yeah.
the logistics, as you mentioned as well, safe carriage,
Yeah.
etc.
Yeah.
Okay.
And I think considering also where the diagnostics, the breadth of the diagnostics themselves, these are, we use this term diagnostic, but it, you know, that's kind of this patient interface tool, but in fact it's diagnostics and testing. So we're looking at everything that's going from a patient doing themselves as an RDT or a pregnancy test or COVID test that they buy at the store to what is in the hospitals for clinical management and laboratory based there, to public health in reference laboratories that might have more advanced but not necessarily diagnostic tests, such as sequencing to look at different COVID variants or whatever else. So it's quite a breadth in and of itself. And when we use this term diagnostic, it's not fully descriptive of that full group.
Thanks, Dr. Well, lots of sage nodding from your fellow panelists there as you're taking. Samesh, come to you. You're working for an organization which is doing a lot of support work. You heard Andrew there talking about a number of the different challenges involved. What do you see as the key challenges for healthcare providers in adopting and implementing more diagnostic technology?
Yeah, thank you first for having us in this conversation. I so agree with the last speaker here. So we are talking a lot about diagnostics and access to diagnostics, and that's so important and can never be overemphasized. At the same time, from a health worker and a health system perspective, that your question is focusing on, what is very important is thoughtful integration of diagnostics within the health systems it's supposed to work and operate under or within. And that sounds very trivial or not so important when we talk about the access, but it is many times or most of the times the difference between successful optimize or utilization of the available diagnostics for the eventual health outcomes that we are all driving toward. So for me, from the health workers as well as the health systems perspective, thoughtful integration of the diagnostics into the health systems, whether that is through the lens of the data systems, from the lens of integration into the health worker workflow, from the perspective of continuity of care, referrals, everything has to be done in a thoughtful manner. And once we do that, that then really helps the health workers in whose hands we are placing these diagnostics to get us the outcomes, the health systems and the governments, the outcomes that we are looking at. So yeah, making thoughtful integration of the health worker, and then secondarily, investing in the capabilities of these health workers is very important. You just don't give diagnostics, but invest in the capacity of the health workers to really use it within within the paradigms of the programs that they are implementing in, and help them understand how this is adding value to their work. So these are the challenges that we have to work on concurrently as we are expanding access to diagnostics from a systems perspective. Hope that helps.
That does help. There's actually one very good question in the Q&A, and I wasn't going to go to Q&A just yet, but I'm going to take this question now. And any one of you, please answer this, or several of you can. And the question is, access to diagnostics is highly dependent on funding. What is the panel's views on the immediate or short-term initiatives that can be done to increase funding for diagnostics? Who wants to try and take this one?
Yeah, so since I have my mic open, or the floor, I'll just get started. It's absolutely spot on. We need to expand funding or increase funding, and in a dramatic manner if we want to accelerate the access to diagnostics in a dramatic manner. And I think there are two layers to do that, or two pathways to do that, and those pathways are both, or rather two layers to do that, and both need to happen concurrently. One is expansion of funding within the country, within the governments, by the governments. And that is very important for the health needs that are already the priorities of the governments. In their programs, in their priorities, the health agenda of the countries, for those diagnostics, I think the health systems need to prioritize their investments and increase their investments. For some of the frontier priorities, something that have not yet landed on the planets of the health systems and the priorities of the health systems, there's a need for catalytic donor and funder funding to help the system understand, the policymakers understand on the importance of it. So to catalyze of uptake of these newer diagnostics, and thereby create a pathway to more funding from the governments themselves into some of these newer priorities going forward. So, yeah.
Thanks, Ramesh. Kenny, you have your hand up.
Yes, I try to answer this very important question, and also everyone need to taking care of it. I believe that from across the ASEAN country, every government investing the funding in healthcare system, they actually the spending in every GDP is increasing. But then on the same time, we are not just looking for the increasing of budget, but also how to make effectively using of the current funding. The current funding, I think, as some government try to optimizing the reimbursement system, I think this is the right way to do. Then how to do more with less. On the same time, we as a manufacturer also can helping our clients and also the government hospital to make the operation more effective. doing more with less investment. And also in a lot of country, the labor cost is much and higher now. So with the automation, with the digitalization, consolidation, actually, which can help. We just talk about the people, the professional training. Training is a major cost. And indeed, we as a manufacturer also looking for how to make the training cost less and make the professional more easy to adopt. And also, we find out that this also is very unique in ASEAN compared with other countries. For example, in Australia, a lot of instrument, the contract life is up to 7 years, 10 years. Actually, the capital investment can be using longer for the hospital. But in a lot of ASEAN countries, the contract is only 3 years or sometimes 5 years. And then we need to reinvest the capital for the new instrument. That actually sometimes from our manufacturing point of view, indeed the useful life can be much more longer with the maintenance. That's also the saving can actually helping the government fund more different tests or also different layer of access. So I think a lot of work can do, but I will say that it's not easy. But as a manufacturer, we definitely can help to improve the efficiency, the using of the capital.
Thanks, Kenny. Andrew, you wanted to chip in?
Yeah, I want to say, I think universally across the globe, one thing that the laboratory sciences are bad at is advocacy. And I think that that shows in diagnostics as well. As far as funding may be increasing, but not necessarily going to laboratory, and it's not sustained. And often laboratories are seen as emergency response aspects rather than a long-term investment that needs continuous resource and development. So I got that comment a lot during COVID of, oh, now we invest in laboratory as an emergency or something toward that effect. Really, laboratory is one that, for an effective ecosystem, like we were talking before, that is a constant maintenance cost. It's a constant development. It's a constant piece of that has to be there and takes years to develop. So it's not at all an emergency response development. It's a long-term commitment. And making sure that you can fit those diagnostics into that system really is where that cost savings, I think, will come, and being able to work through that. So I think being able to advocate is important, being able to talk about laboratories and have people understand that it's not just this esoteric beast over here that pops up during an emergency, but it's a critical part of the entire infrastructure, I think is a big piece of that. And I will say on the other side, direct costs themselves, I think, can be kind of the diagnostics themselves could be, I think, controlled a little bit. I don't want to say controlled. I think that it needs to be optimized a little bit. I think that there's still a lot of bottlenecks in shipping and suppliers and customs charges and different points throughout the entire system, all the way from the manufacturers to the laboratories themselves, that I think could be optimized and better. Promote better competition, promote better pricing, to promote better use across the system, and really help, I think, develop that healthier laboratory diagnostic pricing landscape.
Thanks, Andrew. It's interesting what you're saying about sometimes being viewed as emergency response as opposed to the long-term need. We all know diagnostics actually has the capability to catch things early and therefore actually reduce costs for patients and the healthcare system. Deuce, thank you for joining the conversation. You want to add some comments?
Yes, and I think this issue of funding for diagnostics is important, and hopefully this resolution, among other things, would increase advocacy for increased funding for this And I want to give you an example of what happened, because I was at the center of the COVID response, and as a pre-qualification, I was heading both the pre-qualification of vaccines in WHO, but also diagnostics. And I know, for example, how much money was available for vaccines. We are talking about billions and billions. But for diagnostics, we're talking about a few hundreds of million dollars. Just alone, the advocacy and the need could, even with the stakeholders that were involved in the response, was not equivalent. And yet we have seen, and as I think one of our colleagues was saying, we need to integrate diagnostics in the response. And if we can advocate for this, that diagnostics are part and parcel and an important critical point of any response, then hopefully we can mobilize funding. So in terms of funding, yes, I agree with I think it was Somesh who said, first of all, indeed, governments need to mobilize and look at solutions that they can mobilize funding locally, but indeed, in certain response, in certain aspects, catalytic donor funding would be necessary and hopefully used appropriately. The last bit, and I want to pick on what the last speaker has just said. I think we can use more efficiently what we have. I have seen the issue of these contracts and the duration and the lack of even people spend in capital investment, but with little planning or planning for maintenance, and therefore we lose a lot of investments in this area, which could go 1 mile longer. Thank you very much. And I will use this opportunity to say bye because I have to join another meeting in 2 minutes.
Thank you very much for joining us. Thank you for those comments, Juice, and have a good day there in Geneva. Thank you. I think I saw Harry with his hand up, please. You're on mute, Harry.
Sorry. So, yeah, maybe this is my last comment, because when people talk about funding, it excites me. And I don't know whether what I'm going to say is a bit controversial. I always believe funding can come in many ways, and it should be a shared responsibility. It's interesting to hear what Kenny mentioned about the role of vendors in making lab to become more efficient, so that you can have more cost saving through automation and things like that. Yes, that in a way translates into having more to do more with less. Okay, and it is in a way a kind of funding. When I talk about shared responsibility, I give you one example. Targeted therapy in oncology. So a lot of patients now, oncologists are going towards targeted therapy, companion diagnostic, targeted testing therapy, immunotherapy and things like that. But these therapies are very expensive. But in order for you to qualify patients for these treatments, you need to do companion diagnostic testing. And these testings are also not cheap. So the idea is that perhaps pharmaceutical companies can come into play in sponsoring this companion diagnostic testing for these patients. And that will really help the patients, because they are already facing with a potential high expense in treatment. And the testing is also expensive. But if the testing can be subsidized by pharmaceutical companies and lowered down the cost, then automatically these patients can undergo targeted therapy, and it is more effective. So what I'm trying to say here is that perhaps a companion diagnostic testing should be sponsored by pharmaceutical companies, we have done some pilot projects where we work with some pharmaceutical companies to sponsor this. And from then, when these patients are qualified for targeted therapy, they will get their returns anyway. So that's why I say I don't know whether this is a bit controversial or not.
I'll split it another way, Harry, before you run off, because actually there's a question in the Q&A related to it as well. What about the private health insurers? Do they not have a role here as well in some of these innovative areas to make sure the right coverage is there?
Yeah, okay. Unfortunately, in Malaysia, our insurance scheme is still not yet fully developed as other countries. I agree with you. Our insurance scheme should play a very important role as well, and it need to be properly discussed with service provider like us, because nowadays also whenever doctors do more tests, and when patients try to claim, it got declined because of some policies that say that these testing are not really necessary, things like that.
All right, thank you. I think that's a subject for a separate webinar. But Gillian, we'll come back to you, please. Can you explain more about the role of the private stakeholders in facilitating and supporting diagnostic adoption across Southeast Asia? What can you do as a company to form better partnerships and work more closely with government?
Great, thanks for the question. And I think we've touched on this a little bit, but the resolution itself really does give us impetus to invest more in innovative diagnostic solutions and the necessary workforce, as was mentioned earlier, the supportive systems, and the initiatives that are designed to promote access and equity. And we can only do this through collaborations and partnerships. I can say that specifically on behalf of Roche, we're very committed to providing our expertise as well as our end-to-end organizational capabilities to support countries as they think about how to implement the resolution to improve access, especially when thinking about underserved populations. One collaboration that I will note is we are currently working with our colleagues at Siemens, as well as other industry and non-industry partners, to explore how diagnostics can be part of the geopolitical and healthcare agenda in ASEAN, which gets at sort of how we can get more financial mobilization, et cetera. We're also looking at the health working group within APEC to try to elevate diagnostics there as well. To learn from the example of vaccines. We know there was a vaccine task force that was successfully able to promote collaboration on vaccine policy between the public and the private sector, which enabled the implementation of durable and sustainable immunization programs to achieve goals by 2030. And if we can look to vaccines as sort of an example for diagnostics, how do we set collective goals and really get on a path where we can collaboratively implement together to achieve success in member states? I'll also note that picking up on what Andrew said earlier, it really requires an integration across the testing ecosystem. We can't think about only near patient care or only high complex laboratories. We need to think about the system as a whole. And one of the important recommendations in the resolution is for countries to consider trying to adopt holistic national diagnostic strategies. And if countries can think about taking their disease-specific plans, which include diagnostics, and trying to integrate across those different vertical programs, we can then find some of the efficiencies that we were speaking of to try to have greater impact in some of our programs. And I guess I would like to just highlight, we're aware, for example, in Indonesia, that there's a big investment right now to try to integrate across their entire laboratory and testing ecosystem. And this is led by the Ministry of Health. It's funded through multiple multilateral development banks, and will all, of course, require the participation of the private and the public sectors as Indonesia works to think about a more integrated primary healthcare laboratory testing system. And I think this can serve as an example for other countries in ASEAN.
Thanks, Gillian. One of my biggest concerns with doing my job is I often think we focus too much on the ministries of health when we're having these discussions. We need to broaden it out to a more whole of government approach as well, and make perhaps the economic case for diagnostics, not just looking purely at the funding case. There is a question in the Q&A is, how do we shape policy with government? You just gave an example there, Indonesia. Perhaps for you and Kenny and Andrew and Sumesh can jump in as well. But how do you view how we should approach governments to make sure that diagnostics gets the prominence that it deserves on the back of the resolution?
So I can pick up on sort of what was mentioned by some of the previous participants, but it's really about awareness and advocacy and communicating effectively what the value of diagnostics can be, and speaking in terms that resonate with ministers of finance rather than ministers of health, right? We need to think about what the investment case really is. We know, for example, that diagnostics generally are very cost-effective interventions, right? If you can test people and target treatments rather than more broadly serving health populations, you can be a bit more efficient with your system. So it's coming up with those investment case and making them appropriately and using the language that will resonate for the decision makers in the financial sector. I think it's also, we need to ensure that there are strong advocates from the patients, civil society, workforce, and policymakers, so that we actually can get payers and those who make financial decisions aware of the challenges that are being faced and think about how they can contribute to the solution.
Thanks. Sumesh, you wanted to jump in?
Yeah, very quickly. So I think obviously the need for more policy advocacy work here. I think one tailwind that we can leverage, and I would have spoken this in my closing remarks, is that for this policy advocacy is post-COVID and even pre-COVID, but more so post-COVID, health is becoming a political subject in most countries, a lot of countries. And, first time you will see leaders, on hoardings talking about free vaccines as a political win, etc. And it's expanding to primary healthcare, etc. So very good tailwind from a political lens. We should leverage that this opportunity and frame it in a more holistic manner, right? So this is not only diagnostics for last mile care or care. Diagnostics for what does it mean for their populations as they face the problems of today. So things like, out-of-pocket expenditure. Diagnostics account for anywhere between 15 to 25% of out-of-pocket expenditure is a data I am aware about from a couple of readings that I have done. For people to go from their homes to the diagnostic center, which is very far off, account for another 15-20%. So if you frame it from the lens of things like out-of-pocket expenditure, universal health coverage, things that are aligned to some of the political discourse that makes sense to our decision makers, it can help us in increased investments, or at least our things landing on their priority list. Over.
Thanks. And Kenny. You're on mute, Kenny.
Sorry. I think in vitro diagnostics have a very unique advantage in terms of shaping the policy, because we are more non-invasive, less capital invest, and also the access of the test is relatively easy compared with some big equipment. Some example like colon cancer, fecal ocular, is very effective to screen all the colon cancer patients. The diabetes patient, I think, is a lot of very effective tests can identify the high-risk groups. But in ASEAN, I believe that what we need to do, and also agree with Julian, that is more on the model, the health economic model, how to generate data to prove this preventive screening can help the overall saving of the healthcare spending. The better, the healthier of the citizens can actually saving a lot of treatment costs. And actually, this is also a golden opportunity for like us as a supplier and also with this healthcare provider, is the partnership to do a lot of data generation to actually helping the government to straighten up the policy, because different countries have their own challenges. Majority have the cancer patient challenge and some of the obesity. So I think those are very unique opportunity for we as a healthcare provider, manufacturer, to help the government to shake up the policy. But the evidence generation is important. And the evidence generation should be the population specific, country specific. I think this is something that we still have room to work together to improve the situation.
Thanks, Kenny. We're moving into the last 8 or 9 minutes or so of our time for this panel. There's a very good question in the Q&A, which I'm going to ask each of you to respond to, and perhaps I'll ask Andrew to respond first. The question is, how can this global resolution be implemented in the Asia-Pacific region, and particularly in the ASEAN region, without it being seen as no more than high-level guidance, and making sure it's not too prescriptive as well? Are there roadmaps that perhaps countries should follow out there?
Trying to think if there's any roadmaps that I know. This is not an easy question, and it's different everywhere. As I was saying a little bit earlier, what's right for one laboratory is not right for another laboratory. What screening is done in Middle Eastern laboratories for MERS may not be appropriate for what is done here, and the selection of tests that are used may not be the same, or the conditions of which laboratory operates. So I don't think that there's any one roadmap that I can point to that will really, I think, help this. As far as a localized, decentralized, what I can say is the question is actually dead on too, and that how this isn't, and this is my, I work up at the national level, so this is where my focus always ends up being. But you're absolutely right that this does have to be at every level of the healthcare system in being able to ensure this access. And I think one of the areas that would start is looking at ensuring that those laboratories in the local systems have the resources that they need to be able to implement the correct ecosystem, to get the to have that integrated as was said earlier, and thoughtful selection of what diagnostics are being chosen there, to get the right staff and to have that ecosystem healthy at a local level. And that is not necessarily a nationally prescriptive approach. I think it has to be from both sides. Yes. I'm not sure that I effectively answered the question, but
you did. We had Yuan Lu earlier speaking about the need for perhaps an ASEAN-wide approach on diagnostics and some kind of regional body being set up to look at it. But you're also saying we need to localize what we're doing on diagnostics as well. How do we square those two different ideals?
Well, I think I don't think it's how to say this. I don't think it's necessarily an idea of squaring those two ideas. Healthcare is an integrated system. The public health system needs to flow from the medical system and vice versa. So it is working on those systems. I guess the squareness would be making sure that the data sharing systems, the networking, the flows of that are appropriate, and the decision-making processes are working between those different levels. And that's also kind of a longer term approach. So it's not necessarily, I guess, squaring them. It's making sure that that ecosystem is healthy from both sides, and that there's the correct correct networks to get communication, to make decisions, and approach that.
Thanks, Andrew. Kenny, you unmuted yourself. Do you want to add something?
Yes. It's very difficult question, especially we as a manufacturer we are not the policymaker. We are more following the government policy, but we can do in our part. I can think about several things. I think it's the how to work with our clients and partners to build a quality system, a high quality, reliable laboratory testing solution. Because this is very important. The quality not just only about the reagent instrument, it's a whole ecosystem, including logistic delivery, service, and post-market troubleshooting, and also some advanced clinical dialogue. If the patient has the data have some, I think this is something that we should invest on the market that is a big country like Indonesia, Vietnam. It's a big population and the access is very difficult. And I will not underestimate the logistic. The cold chain is the most challenging. And also the technology breakthrough also helping, like some point of care tests can be shipped in a more challenging environment, like the room temperature with the refrigeration. I think those is what we can do. Another is we need to build some technology and system is repeatable. Because in some situation, a lot of laboratory like is a very tailor-made, based on their own situation, workflow, and the patient and the testing. But when we talk about tailor, it's difficult to repeat. If you want to have more people and patient accessible, your solution is easily repeat at the lowest cost, and also the cost including training, implementation, logistics. I think this is something that, as again, we are not the policymaker, but if we are able to provide a solution, able to implement easily at a reasonable cost, I think that the paper and the recommendation can be easily implemented. I think this is what we as a Siemens Healthineers, as a manufacturer for IVD tests, I think this is what we can do.
Thank you. Okay, we're coming to the end. So the usual crystal ball glazing question to wrap a discussion up. Looking ahead, what are your hopes and aspirations for the future of diagnostics? What can we do to help use that to improve the healthcare landscape and, of course, improve patient outcomes as well? Gillian, can you go first on this one?
Sure. So, I mean, I think we would really like to see the systematic shift from treatment to prevention. I think, as we discussed earlier, diagnostics really should be seen as an investment, not a cost. And hopefully, looking ahead, that's where we can go together. We would certainly hope in the next decade that we're able to close the almost 50% gap in access to diagnostics, so that we can have stronger, more resilient health systems, so individuals, irrespective of where they live, can be empowered to have healthier lives. And I think we would hope to envision a more integrated diagnostic system where both digital information as well as all of the different disease management solutions can be fully integrated for timely, effective, high-quality care globally. So, you know, pretty easily achievable, I hope. Back to you, Chris.
Like a challenge. Andrew, from a CDC perspective, what do you see as the future?
Oh, I think what Gillian said was easy or not easy, sorry, it was right on and interesting. I think we're post-COVID in an interesting era where diagnostics might be undergoing a major shift. We have a lot of technologies that are emerging that I think will fundamentally change the the approach to diagnostics. And I think this emergence of exactly what she was saying, the digital sphere, and the proliferation of the digital sphere in health records and health meets, and then how that meets big data in laboratory, I think is going to be a rather interesting combination. So I'm looking forward to what that will bring and how that can change things. Beyond that, what I'm hoping, the other, I think, shift that COVID is promoting is now we have this RDT and people know that they can go to a store and buy something and get testing. So we've in a way decentralized the testing for this one thing, and I'm hoping that promotes people's interest and promotes the greater awareness of diagnostics and promotes a greater decentralization. So it's not just this clinic over here that can provide advanced laboratory testing, but we're able to get the correct diagnostics to people as they need them, so that we can really advance that access issue. So I'm hoping that that's another major shift that's coming after COVID.
Thanks, Andrew. Kenny, your last thoughts, please, on the future.
Technology will change the landscape. A lot of technology before is only able to implement in a very sophisticated lab, highly trained professional. But I do see a lot of technologies very able to easy to cater and also accessible in a very efficient and cost-effective way. With this technology breakthrough, I believe the access of care to more test availability will be more easy. But again, I think go back to the question is the policy, how to make a government aware of diagnostic tests can make the society even more healthier, can be more preventive rather than spend money on treatment. I think we still have a long way to go. So I think hopefully the technology is more easy to access by the government and the medical society and the patient. I think that will change the way the government look at IVD. And I'm very positive on that one.
Thank you, Kenny. We've come to the end, and I'm going to hand the reins over now to Dr. Shimesh Kumar from JAPAGO for the closing remarks. You might want to cover off that last question at the same time.
Yeah, sure. Thank you. So I think we have had a productive discussion on the increasing the availability of high quality diagnostics globally and today, obviously, in the ASEAN region. And as we have heard, this is a critical agenda for public health outcomes across our diverse nations in the region. We have kind of discussed on some of the key challenges across countries, supranational challenges, so to speak, and these are inadequate investments and prioritization of diagnostics as an important element of the health system. There are infrastructural needs that need to be looked into and invested into. We also talked about inequity in distribution and implementation capability limitations. We talked about the need for the health workers' capability to execute diagnostics to be invested into, as well as systems capability for thoughtful integration of diagnostics in the overall health system. So there's a major design element that is required for optimal utilization of diagnostics and increased access to diagnostics towards better health outcomes. So what is our argument for increased investment into diagnostics? Why should countries and other stakeholders prioritize investments into diagnostics? So essentially, our pitch can include some of the following elements. And I've listed 5 or 6, but these are not exhaustive, right? So one is diagnostics lay the foundation of effective treatment. Accurate and timely diagnosis are cornerstone of effective treatment. The right tests help health providers identify the cause of illness, leading to proper medication, thereby reducing, or surgeries, thereby reducing the cost and improving the efficiency and effectiveness of the eventual management. It also helps thereby in the new problem that we are facing, or not so new, is antimicrobial resistance, which is going to be a big thing. It's already becoming a big thing, but will be a much bigger priority in days to come. Diagnostics also play a very important role in early detection and prevention. So we move from a paradigm of management to prevention over time, and that's a very healthy thing for both the health systems, from the cost effectiveness as well as from a population health outcomes perspective. Of course, I talked about cost effectiveness. While diagnostics may require initial investments, they are effective in the long term, cost effective in the long run. So it's a very important framing that I heard somebody say, that they should not be talked about as a cost, but as an investment. And early and accurate diagnosis can prevent unnecessary treatments, complications, thereby reduce cost in the long term. And most importantly for me personally, diagnostics promote equity in healthcare. And so UHC aims to provide access to quality healthcare for all. So ensuring the availability of and affordability of essential diagnostics is crucial to achieving equitable access to healthcare regardless of income and location. So we discussed some multi-pronged actions here. We talked about concerted and coordinated policy, advocacy, and stakeholder education, and a whole of government approach to move the agenda for definitively. Increased investments for increased access to diagnostics, as well as into the implementation capability for thoughtful integration of diagnostics through a health systems approach. And increased global and regional partnerships and collaboration towards exchange of learnings and challenges, data on outcomes and impact, as well as resources for training and capability building of health systems. So to close, strengthening diagnostics capacity improves health outcomes and strengthens health systems, making them more resilient to crisis and better respond to upcoming health emergencies. By bolstering diagnostic services, health systems can effectively monitor diseases, respond to outbreaks, and implement targeted public health interventions. For the multiple challenges we face in moving this agenda, we have a major tailwind with us. And that tailwind is the fact that healthcare is increasingly becoming a political priority for the governments in many countries, more so in the ASEAN region. Countries have realized the importance of investments into primary health care and into universal health coverage. This gives us a great opportunity to advance the agenda of universal, equitable access to diagnostics in the different levels of the health systems, not as a standalone investment, but as an integral part of the health systems that will be deployed through. This has been a great conversation and exchange of perspectives on this important need of the health system. I'm confident that there is only one way as far as the equitable access of diagnostics as an integral part of UHC is concerned, and that is up and forward. Thank you.
Thank you very much, Dr. Samish. I can only agree with all those words. Thank you to my fantastic panel, to Gillian, to Kenny, to Andrew, Dr. Samish, Harith, who had to leave us early, and also then to Juice and to Honlu for their speeches. Fantastic conversation. Diagnostics is an investment. It's not a cost. It can lead to better outcomes for patients. It can lead to better lives for patients. Governments need to view it actually in broader economic terms at the same time. I think, and it's definitely not just there for emergencies. It's there for all of our lives, all of the time. Thank you again to all of you. Thank you for our audience for staying with us. I think the recording of this will be online at some point if you missed parts of it. Jen saying yes to me. So with that, I wish you all a good evening ahead, or a good rest of your day if you're tuning in from a time zone behind where we are in Singapore. Thank you very much.